Fast forward 20 years into the future, now we have multiple therapies that we can use to take care of patients. We know that they work. We know the size of the impact they have in patients. And we're really, I think, at the beginning of having therapies that are truly breakthrough therapies.
I can't tell you how thrilled I am about the state we are in CF right now.
The mood among not just the patients, but among the staff treating patients with CF has turned around completely because we now have real hope.
We can see huge changes in patients' lung function, their survival, their nutritional status. So it's very clear that at a given age, patients are doing so much better than they were 20 years ago.
We no longer have to worry about children suffering, suffocating, being severely malnourished.
For nutrition care, it's a whole new ballgame. Today it's preventative nutrition, and when I first started, it was rescue nutrition.
One can immediately see the nutritional benefits, fewer hospitalizations earlier in life. Parents who are part of the team now and come into the CF program not with frustration, but with much more of a sense of teamwork and optimism.
Fortunately, this is a new day for children and adults with cystic fibrosis.
Clearly, for patients with gating mutations, we have a drug that's available for them today, ivacaftor, and that is a total game changer.
We finally have something that could potentially address and make a difference in our patients with the most common mutation.
Having worked in the laboratory on CFTR and its ion channel properties, to see a treatment come along based upon activating this channel. It's truly remarkable for me to see this.
I was very happy that finally a drug was identified for cystic fibrosis based on the gene discovery.
Without the gene, there could be no potentiators, correctors, CFTR-directed therapeutics. The development of all of those therapeutics depended on having cell culture assays made possible by having the gene product, being able to express it, and understanding how it worked.
It was a complicated process, and it really required, I think, the collaboration and cooperation of academic labs and industrial scale screening and medicinal chemistry. It was a remarkable tour de force.
Ivacaftor only affects 4% of the CF population, but the reality is it shows that we can do this.
Our promise to our community is that we have to treat 100% of our patients with disease-modifying therapies.
And again, it sort of shows proof of this whole principle that as we improve chloride transport, we see an improvement in outcomes.
And seeing my fellow CF patients benefiting from this drug is amazing to me, and I'm so happy for them and hopeful for a day that it's available for everyone with CF, not just Delta F508 mutation, but anyone who has cystic fibrosis.
I feel very thankful to be alive here at 51. It was very hard to see that age when we were kids.
We're in a whole new era. This used to be a pediatric disease and pediatric disease only.
My pediatric pulmonologist was so important to my family. We had such a great relationship, and I remember not wanting to transition to the adult clinic at all. I was reluctant to leave.
We talk to kids about transitioning now. They're like, I don't want to go. I've been with you for 20 years. And we say, no, this is a good thing. This is a celebration. This is not a bad thing to be able to go to the adult CF clinic, because like I said, we didn't have one when I first came to work here.
None of what we've seen in CF would be possible without the enthusiastic participation of the patients in clinical trials. And most of them do it with little expectation of benefit for themselves.
Being involved in clinical trials is very important to me, and I think for the whole CF community.
It's just part of my way of giving back to the community and giving hope back and give hope to others with CF.
Some of them do it and they say to you right out of the gate, it's for the kids. It's for the next generation of CF patients. I'm here taking this chance, taking this risk for the kids.
Preserving lung function, maximizing nutrition become even more important, so that when a really, really effective therapy becomes available, patients will benefit the most.
As an adult, I've been diligent about not only sticking to my treatment regimen, but exercise and making sure that I can stay as healthy as I can for as long as I can. And that's what inspires me to sit with my vest on for hours every day, or go running, or do all the different things that we have to do.
So we've greatly extended the lifespan of cystic fibrosis patients. We've greatly improved the quality of life of cystic fibrosis patients. And we have changed their expectations and their dreams.
All but one of my patients is over 50, and I had the pleasure of hearing from an emergency room doctor when one of my patients developed acute belly pain and went to his nearest emergency room, and we had a call from the emergency room doctor who informed me he could not possibly have cystic fibrosis because he was 62. And you know, in some ways, that's a triumph.